and you see these different acronyms and different accomplishments, I want to show you a little bit of the behind the scenes journey and what actually went into it and some of the mistakes and bumps along the way to kind of encourage you that your journey can also end up in a completely different place that you may have never imagined. So, a little bit about myself. I actually started out as a pre-med student, believe it or not. I was in college for about 6 years, kind of flailing, not knowing what I was doing, procrastinating, trying to delay the MCAT for as long as possible because my heart just wasn't set on it. Like many immigrant kids, my cousins are all physicians, and we had like one of three paths set out for us. It was like you could be a doctor, you could be a lawyer, an engineer, right? And I knew growing up that I always liked science, and I wanted to be of service, and I wanted to do something that, brought some kind of order or sense to this very chaotic world. I grew up in Queens, New York, in a very low income household. My parents were immigrants that came from Pakistan. And I just saw them work so hard their whole lives. And I always question, like, is this my purpose? Just to work and pay my bills and fixate on money my whole life? And is that it? Is there nothing more to it? And so just kind of that journey to try to find meaning, right? And knowing that you like certain subjects and certain things, but just not knowing exactly how you fit in. And it's interesting because when you look at my journey from an outsider, you kind of see different rungs of the ladder that I may have climbed, right? So you see that I started out as a scribe. I actually received an email. I was part of some kind of pre-health key club in college, and I received an email that said, "Do you want to be a scribe in an emergency department?" This is circa 2010 when scribing was very new. For those of you that don't know, scribing basically is a documentation type of role where you work in either a clinic setting or in the hospital or in the emergency department, where you follow the physicians and you basically do their documentation for them. And that includes the patient interaction and the labs and differential diagnoses and things like that. So my dad had a very strict rule. He said, you can't work, you can't do random retail jobs, you have to focus on school. If you're going to work, it has to be healthcare related. So I thought, great, this is a good way to get some experience. And started as a scribe, moved on to be an EMT, went on to nursing school, got my master's. Now I do global humanitarian work. I have published several articles, I've gotten several awards, I'm on social media. And you look at all of that and you think, oh, wow. And it looks really linear, right? You look like, oh, you did all the right things. You climbed every step of the ladder. And that could not be further from the truth. So I mentioned earlier that I spent 6 years in college just not knowing what I wanted to do. I was a bio major. Like I said, my cousins were doctors. I was pre-med for a long time thinking this is the only track for me. And if I like science, then I have to be a doctor, right? And it's just so interesting because all of that time that I spent in college, I thought was so much time wasted, so much money wasted. There was a lot of self-doubt. There was a lot of familial disappointment. What are you doing? Why haven't you applied? Why haven't you taken the MCAT yet? All of this, right? But you wouldn't have guessed that if you looked at my credentials and if you looked at kind of the body of work that you see now. And it's interesting because I think in the fifth or sixth year in college, I was like, okay, I just need to finish out this degree and graduate and get my foot in the door, get some clinical experience and figure out what I want to do. And to me, trusting my intuition was also another journey and was really important to kind of hone in on that feeling of like, okay, why am I delaying taking the MCAT? Or maybe this is not what I want to do with my life. So when I started working as a scribe, I actually saw how badass nurses are, right? In the ER, they were doing all kinds of amazing procedures. They were some of the most intelligent people that I had come across. And I, beyond just nursing, was able to see that the hospital environment only works because of this dynamic teamwork, whether that's radiology technicians, whether that is scribes, that's physicians, that's APPs, PAs, CRNAs. I mean, just so many different avenues in healthcare that work together to create like this cohesive environment. And I was just so inspired by that and the work-life balance that nurses had. Before scribing and working in the hospital, I had no idea that you could be a nurse in a hospital, work 3 shifts a week, and that was full time. And that kind of supported my goals and my personality more because I wanted to have that work-life balance. I was always the kid that had 100 hobbies going on, and I wanted to travel and I wanted to do all these other things. And, I just found that nursing fit that mold and that life goal that I wanted better than being a physician. And not to say that I couldn't have done that or I don't have extreme amounts of respect for my physician colleagues. I do. But for me, that seemed to be a better work-life balance. But again, it wasn't a linear thing that you got there. It wasn't just like step one, step two, you're there, right? So eventually I was an EMT. I did some work as an ED tech in the ER, in the field. Eventually went back to get a second bachelor's degree in nursing, which again, at the time it felt like, I didn't do it the right way. I didn't do it in a linear fashion. I should have just had this figured out. But looking back on it now, I think that every experience that I had was so valuable and added to the kind of nurse that I am today. And, it's interesting because 6 months into being a nurse, I was newly married. I was, I think, 25 or 26 years old, and my husband lost his job. He was laid off. And I was making, I think I had, it was just near graduation. I was making 16 bucks an hour as an EMT, had no idea how I was gonna pay for nursing school or do any of this. So there's all these like financial challenges that come into play, right? And you think, wow, this is one of the hardest challenges in life. And then as you go through life, you get more challenges. So a couple of years into nursing, I'm a big hiker. I do a lot of like rock climbing, mountain climbing, that type of thing. Big plot twist comes, and I actually fell 15 feet and broke my back. So this is like 2 to 3 years into nursing. I'm a brand new nurse, have these massive like T11, T12 fractures, almost paralyzed myself. And, thank God that I still have both feet to walk on today and was able to get through physical therapy and all of these different things and kind of got a second chance of life, honestly. And I don't usually talk about that part of the journey, but the reason I'm telling you about that today is again, looking at my credentials and looking at, social media or whatever, these filters and these snippets of reality or these highlight reels, you would never really know that that was going on behind the scenes. And I actually completed my master's degree while being unemployed and in a back brace because I had nothing else to do and I was so desperately bored and I was so tired of knitting blankets and crocheting and doing any other like seated activity that I was just like, you know what? I'm not going to take a pause. I'm just going to go ahead and complete my MSN. And, but yeah, again, you wouldn't have known that just looking at the credentials, right? So, all that to say that life is going to throw challenges at you and people are not going to know all of the work that you've put in, but that just makes you even better of a provider, no matter if you're going into nursing or healthcare, um, any kind of career, really, any kind of career that ultimately benefits people. That empathy that you gain from being a patient yourself or going through those struggles yourself ultimately give you those tools for empathy. And um, really, I had mentioned kind of the inspiration for going into healthcare in the first place was trying to find some kind of order in this chaotic world. And I'm going to see if this video plays just kind of a short snippet of a recent medical trip that I did in Pakistan where I was a triage nurse. And it's not very different from a day in the life and triage here where you're multitasking, you're in kind of a controlled chaos environment where you may be seeing hundreds of patients at a time. You're trying to kind of sort through and multitask. As an ER nurse, you have to be adaptable, you have to be comfortable with discomfort. Every day is going to look a little bit different. And that's what I really love about the ER is you walk in and you could be walking into any kind of patient assignment. You could have a very sick patient that's on a ventilator. You could be walking into, a young patient with abdominal pain that's stable. You walk in and you get your shift report. You look at your patients. Usually you have four patients in a normal emergency room setting in here in America. And you kind of have to assess, okay, who's my sickest patient? Where do I have to go first? Who needs my attention first? Who do I have to assess first? And when I have nursing students and young nurses, what I tell them is all you can do as one human being is you can see your sickest patient first, and you can only do one thing at a time, right? And people always ask, well, what are the qualities to be a good ER nurse? You have these vague concepts like critical thinking and multitasking, but really adaptability and flexibility is going to be your biggest asset here, knowing that anything can change at any moment. But when you're working in these high resource settings especially in developed, areas where you have high resources and well-stocked hospitals, you're still working in controlled settings where you have policies, you have procedures, you have resources, you have teamwork, you have mentorship. Nurses are constantly juggling multiple different things. We are dealing with obviously the medical complaint that the patient is going through, but we're also doing what we call invisible labor, which, could include a number of things, which is such as the patient's emotional well-being. You are dealing with updating the family. You're translating for the patient what the physician is saying. You're advocating for the patient. You might be working in pandemic settings or emerging disease. I remember when I was a new nurse and we had a big Ebola outbreak here in Dallas, Texas, where I'm at. In the emergency room, you really are like that first line of defense, whether that is for infectious disease or figuring out what's wrong with the patient. They are coming to you as a big question mark. You may not have much information at all, or they may be coming in unconscious, and all of a sudden you're having to piece together your examination skills, your assessment skills, pairing that with the diagnostics, communication with the rest of your team and your physicians and your colleagues and your staff to try to figure out, okay, what's going on with this patient and how can we best advocate for them as an individual, right? So, as a nurse, I always like to say that my job is to promote your autonomy as a patient, to provide you with dignity and to have mutual decision making. Nurses are not there to have this power dynamic of telling patients what they need to do, right? So we have to come from a place of non-judgment. We have to understand that different people come from different backgrounds. There's different traumas that people have experienced. Being a person of color, we also have to kind of decolonize health in our mind and understand that different people have gone through different things. Women are going through different challenges, and there are, communities that have been underserved, or there might be some mistrust with patients being undermedicated, or their pain not being controlled, or certain groups of people not being taken seriously and their concerns not being heard. And, patients may come to you with this sense of mistrust that you're having to navigate all of a sudden. And, just knowing at the end of the day that this is not coming from a place of something that is like they're personally offending you or in any way, but coming from a place of they may have mistrust and trauma in the past that you have to navigate now. So that's kind of some of the invisible of labor that we may not talk about on the forefront when we talk about like clinical aspect of care. And the other thing is that your empathy and your intuition is going to be some of your greatest assets and your greatest tools. I used to have a clinical instructor and a mentor that used to say that your clinical intuition is nothing more than your brain putting together subconscious cues and different signals that your brain is picking up from the environment and putting together and kind of ringing alarm bells in your brain that you may not have consciously recognized yet. So paying attention to that intuition, and it doesn't develop overnight. You definitely have to hone that over time. You don't know what you don't know. A lot of the time, nursing school, medical school, all of these clinical rotations are not going to fully prepare you for careers in healthcare. You're not going to come out of nursing school or medical school or any of these schools knowing everything, right? You're going to have to lean on your mentors. You're going to have to lean on the teamwork. You're going to have to ask questions that may seem silly at the time, but I promise you that as experienced nurses or as mentors, we would much rather you ask a question and learn and be able to identify what you're uncomfortable with rather than just making it up or going on with it without knowing, because these are people's lives and livelihoods at stake at the end of the day, right? So, again, our job is to advocate for patients and empower patients to make the right decision, even if those decisions, the right decision for them, I'm sorry, even if those decisions don't necessarily agree with your values. And sometimes people will refuse care as well. They'll say, no, I don't want to do that, or I don't want that medicine, or they may have some, preconceived notions about certain things. And our job is to educate them and say, these are the recommendations. This is what, the physician is recommending, but ultimately our job is to promote that autonomy. And, a key insight is that especially in the Western world, really rely on machines and resources and numbers, but we always like to say that we are not treating numbers, we are treating people. So there is a big emphasis right now on, electronic health records and AI and tech and different things that can be amazing tools, but they will never replace your human intuition and that human connection and that empathy that you're making. There have been times where I've had preceptees and nursing students that have been very focused and been trained to focus on the computer and the protocols and all of those things. And sometimes I have physically like taken them and turned them and said, look at the patient, look at what pattern that they're breathing in, look at what they're telling you, because the patients often not often, every time, know more about their body than you do, right? They've been living in their body their whole life. So it's so important for us to listen to those cues and be open to those things. And part of what goes into emergency medicine at home, for me particularly, is the work that I do in global health and disaster medicine and humanitarian medicine. So you might ask, like, how does one get involved with that? In the introduction, they mentioned that I have been to Gaza. I just came back from a humanitarian mission in Pakistan, which is my own, motherland, and I went to a rural northern part of Pakistan, a mountainous region in Swat Valley. And, again, you may ask, like, how would you get involved with something like this? So I've always been interested in being a global citizen and understanding, again, how I can give back with all of the privilege that I've been given to be of service to a greater community. My parents were very big advocates of service work and big believers that we can only heal ourselves and as a world if we are able to give back to not only our local communities, but the greater global community. And again, we've been given so much privilege compared to so many places in the world. And, in places like Gaza specifically, a lot of the time it is ultimately our funding and our, part of our responsibility to be able to go back and as healthcare workers, be able to give back to that community. And so the way I got involved with this really was through being an EMT. I was exposed to a lot of colleagues that were active in different social justice issues and were volunteering in different places. And one of my first experiences in disaster relief was Hurricane Harvey in Texas that came through the Houston and southern Louisiana area. And so we had a lot of refugees that came from that area to Dallas. And we had set up a field clinic through the Red Cross. And I was able to, as an EMT and a nursing student at the time, get involved with that and, just ask questions and say, hey, how can I help? I know I have limited experience, but if there's something I can do to get plugged in, I would be, so happy to be of service. And so I was working at this field hospital and field clinic, and it was very interesting because we still in that field hospital had certain resources and certain things that were donated from surrounding hospitals. And it was so eye-opening to me of how different medicine is with lower resources in a setting that you don't know where things are. You are not kind of in your comfort zone. You're working with different people. You have limited information. A lot of these patients were coming in and their medications had been washed away in the hurricane waters and the flood waters and Hurricane Harvey. And they would come in with these conditions. And a lot of these patients had lower health literacy. And they would say, I'm a heart patient. I take a heart medication, but I have no idea what it is. And you're like, okay, well, you're in atrial fibrillation or you're in this. So what can we give you and how can we get you these medications? So it just opened up this whole new world for me of, the chaos in the ER, yes, but this was a completely different type of chaos and new barriers to healing that I was exposed to, where I was having to piece together social determinants of health and to try to see how I could best advocate for these patients and coming up with these creative solutions. That was kind of my, introduction into disaster relief and triaging these critical patients where the ambulance would bring in patients from, different areas and we were piecing together, okay, how can we help address their acute condition? What's going to harm them first? How can we minimize that risk? And then how can we go on to help them find some sense of normality in their life through this tragedy that they're going through. They've lost their homes, they've lost their possessions, they've lost a lot of their family members, any access to care. And so, really, and that was the first model and exposure of, okay, triage in this setting is very different from triage in an emergency room, where now we're talking about survivability, we're talking about allocation of limited resources, we're talking about safety concerns. In a lot of these areas, you may have limited to no PPE, you might not have gloves available, communicable disease might be very high rates that you may be exposed to. Again, that kind of first line of defense thing. And you can kind of see in these pictures on the slide, this was the emergency room in Gaza, and this was one of the triage tents that I was working out of. You can see I'm kind of digging through a cart of very limited medications that we had. And that top picture is in the resuscitation room in Gaza, where you can see we have little to no supplies. We have one cardiac monitor. This was a 25-bed ER, and we were seeing upwards of 700 to 800 patients a day. And you can imagine we were seeing all sorts of things, including acute trauma being the number one thing, explosive injuries from bombs, from shrapnel. When we talk about explosive injuries, we have primary, secondary, tertiary explosive injuries, where primary injuries are caused from explosive devices. Secondary injury may be caused from debris and shrapnel. Tertiary injuries may be injuries that people see that are a little bit further out from blast radius. But beyond that, you see chronic conditions that are not being treated, diabetics that don't have access to insulin. You see young people dying of things like liver failure from hepatitis, which is a completely treatable and preventable disease, especially hepatitis A, which here is just supportive therapy and fluids, and most people go about their day and are fine. After that, we were seeing young people die from that. And so, it was very difficult to see these different things, but that first initial experience with Hurricane Harvey kind of opened the door into, we have so much of suffering here locally, where there are different health clinics and different things that I volunteered with. And that kind of opened my mind to, okay, maybe I need to step out of my comfort zone and see what's going on in the rest of the world. And really, the biggest takeaway from that isn't even the case studies. The biggest takeaway from that is the fact that we have such a profound responsibility with all the privilege that we have. And for me personally, somebody that was almost paralyzed from a back injury, it would have changed the whole trajectory of my life, right? I wouldn't have been able to be a nurse anymore, wouldn't have been able to do these missions anymore. And so I felt such a profound responsibility to go on and do more work with the second chance that I had been given. And the second thing with any kind of travel or global humanitarian work is that when you go to these different places, you see that people live differently than you. But at the end of the day, their human needs are the same. So in nursing, we have this concept of Maslow's hierarchy of needs, where we talk about, people needing safety, shelter, food, and water. And then after that, they can move on to have any kind of self-actualization or anything else, right? You need those basic needs before you can do anything else. And so when you go to these different areas, you see that people have different cultures, different religions, different grief practices. However, their basic needs are the same, right? They want food, shelter, safety. They want to live in peace, and they want to be able to feed their kids. And, we talked about the fact that we all kind of have a role to play, but nursing isn't just a clinical role, and healthcare in general isn't just clinical, it's a human right. And part of these missions, whether they're again local or global, is just the power of witnessing. In Gaza, a lot of the time, we weren't able to do a lot clinically for these patients. It was very difficult because these patients didn't have anything to go back to. They didn't have homes, they didn't have clean water, they didn't have food. And it really limited my ability to teach as a nurse. When I discharge people here in Texas, I'm able to give them a set of education where I'm like, okay, you're going to go home, you're going to complete your course of antibiotics, you're going to eat high protein food. This is how you're going to clean your wound. When you don't, when you have patients that don't have access to any of those things, it really drastically changes what kind of nursing you're able to provide for them. So a lot of the time in Gaza, and you'll find with some of my colleagues that have done work in other war zones like Ukraine and some of these other places like Sudan, you'll see that our role really changes into a role of witnessing and advocacy, where we come home and we're able to do things like this, where we're able to talk to you about the different things that are going on in the world and our responsibility to, help in those settings, but also you can see a picture of me on Capitol Hill recently where I went and I was advocating for increased humanitarian aid and open borders and the allowance of medical supplies into Gaza. And, again, that's a responsibility of what I witnessed for me to come home and not only relay it to you and to my colleagues, but to also advocate that my patients in Gaza are able to get the same medications and the same dignity of care that we get here. And that role of me being a humanitarian doesn't end at, okay, I did this 2 week mission trip, I pat myself on the back and I treated XYZ patients and I'm done, right? It doesn't just stop there. That responsibility, if anything, feels more heavy when you come back home. So these are just a few more pictures from Gaza, just to kind of paint you a picture of what we were working with. I think the picture of the child sitting in the rubble is really profound. This is all this child has left of his home. And these were the patients that you were treating, just to kind of paint you a little bit of a visual picture of what these people had to go home to. And again, not all missions are this dire. Of course, in Pakistan, we had a different scenario. Sudan is going to be a different scenario. Gaza is a very, very unique situation. It's one of the most dire situations that any of us had ever worked in. Even my colleagues that have much more conflict zone experience than I do said it was one of the worst situations, humanitarian situations that they've ever experienced. And the tent picture that you're seeing that says UK aid, this is where people are living. These are thousands of people, thousands of patients that are living in and around the hospital in these makeshift tents where they have no protection from weather. They have one bathroom that is shared among thousands of people. When I came back, part of the reason that I wrote an article for the Journal of Emergency Nursing, I am not somebody that was ever interested in research. I never thought I would write an academic article, but coming back from Gaza, I actually wrote several of them. And the only reason I did was to relay what I saw. But part of what I saw as a female nurse working there was that I saw so many complaints from females coming in where, lack of prenatal care, they didn't have privacy, they were being exposed to so much communicable disease because they had to share one bathroom with all of these different people. We talk about things like menstrual care. A lot of women in Gaza didn't have menstrual pads, and that is something that is so inconceivable to those of us that are privileged and born and raised in America like me, where I can't even imagine as a female not having period products, right? And so for these women to come and tell me, well, I don't have pads and I'm using tent scraps or a piece of my child's diaper or my, headscarf or a piece of a towel or what have you, and then that leading to infections, that leading to things like UTIs and kidney failure and different things that you would never see in this setting. And again, like it's just so eye-opening to me because you would never have imagined that. I would never have imagined that in this setting that I'm working in. And so really all to say that you go on these humanitarian missions, even locally when you do service work at health clinics and different things, which you can also do as students. It's just amazing because you see that people live in very different ways. And especially in places like war zones where healthcare systems are devastated, whether that's places like Gaza where there's a purposeful destruction of healthcare, or whether that's in natural disaster zones where people have gone through earthquakes and different things where their health system is decimated. And then really you are a critical access point because your organization may be the only resource that they have at the time bringing in critical supplies and medications and different things that are really life-saving. And I want to just touch on the fact that I learn more from these missions than I can ever give to these nurses or these healthcare providers or these patients. When I went to Gaza specifically, but also when I went to Pakistan on this last trip, I was so astounded and inspired by the way that the healthcare workers function there. You can see on the slide this bag of saline that's hanging or this bottle of saline. We didn't have IV poles in Gaza. So me as a very privileged American nurse, I'm holding this bottle of saline, not knowing what to do with it. And a very clever Gazan nurse comes up to me. Mind you, they haven't been paid for going on 2 years now. They are, not clocking into work. They're all volunteers. And when you ask them why they do it, they say that everything's been stripped from them except their mind and their knowledge and their education that they've had. So their responsibility to their people is to give them some semblance of dignity because everything else has been taken away. And so their ingenuity and their ability to MacGyver things is beyond unbelievable. So as I'm standing there, this Gazan nurse comes up and he goes, "Oh, don't worry, Hakuna Matata," and takes this extension tubing, makes a lasso, throws it over that beam that you see in that picture, and somehow makes an extension and hangs the fluid off of that. Something I would have never thought of, right? But again, this is one of those critical scenarios of like desperation is breeding ingenuity. And that middle picture there you'll see is their library in the hospital where these nurses would work in these mass casualty settings for 48, 72 hours at a time. They would go back to their tents to check on their family. They would come back and then they would spend a couple hours in the library just going through what procedure they did that day and trying to brush up on their knowledge because their universities have been destroyed and their clinical rotations have been halted. And it was just so amazing to me because I thought about myself during COVID and how exhausted I was. I was being paid handsomely. I was coming home to safety and security in a warm bed, and I wasn't doing nearly any continuing education. And so, just so much inspiration from these nurses. And you can see kind of in the tent there that they have created sort of a makeshift privacy wall with these COVID gowns that they had because we were examining so many females. And to give them some sense of modesty and dignity, they had created this wall. And so, even in this chaotic situation where we were seeing hundreds of people, they never let patient dignity be lower down on the priority list. It was always top priority that patients were treated with dignity, that women were covered, that modesty was preserved in all settings. And again, that was so inspirational to me because here when I get busy, sometimes you think, well, we'll just do this really quick, or you start to cut corners. And when you go to these places, you think, wow, that kind of just recenters so much of your priority. These are just a couple pictures from the Pakistan medical mission that I did, which was very vastly different from Gaza. Thankfully, we were not treating any mass casualties or acute trauma. It was more chronic conditions. And, you know, there we saw more of a difficulty in accessing basic health, chronic conditions, lack of hand hygiene, and things like that, where it was more education based, where we were educating the patient population there. And same thing there, the nurses were so inspiring. There were nurses that were working as midwives, as, social workers, where they were making house calls to make sure that these women in these remote mountainous regions could have access to some semblance of prenatal care. And just, really inspiring stories as well there. And having said all of this, I think some of the key takeaways that I want you guys to leave with, if you don't remember anything else that I've said, is that your life experience is your greatest clinical tool. No time or experience is ever wasted. Every hardship, every challenge you go to, it's going to give you more empathy. It's going to give you more of a sense of, understanding of what your patients are going through. Because I had to wear a back brace for almost 4 months, I'm able to give people the most detailed advice on how to adjust that brace and, how to prevent rashes and different things. Probably, things that I would have never known if I hadn't worn it myself, right? So, same thing with all of the other challenges that you go through in life. And your authentic self is your best application, and your best attitude is going to be to adopt the attitude of a lifelong student. I always say that I strive to be the dumbest person in the room. I can always learn from everyone, including each one of you here today in this setting. And that just allows me to go home every day and say, "Wow, I learned something new today." So always keep your mind open. Have that attitude that you're a lifelong student and there's always something new to learn. There's always, clinical indications that are changing. There's always new research coming out, and it's kind of our job to stay on top of that. But beyond that, there's a lot of clinical advice and a lot of application advice that you're going to get. But my advice is going to be a little bit different. And it's going to be that you should work to live. You should not live to work. I love nursing, but at the end of the day, nursing is not my entire personality. I have lots of hobbies. I have a very robust life outside of work, and that really fuels me to be my best self as a nurse. We talked about empathy and intuition and patient advocacy. And again, all of our careers in STEM, our job is to reduce harm, it's to improve agency and autonomy, and to provide non-judgmental care to empower people. At the end of the day, we really should all strive, no matter what career we're in, to be better global citizens. And as far as being a lifelong student is concerned, what I am currently learning right now is to how to be a better global citizen. I'm learning about decolonizing health. I'm learning about social determinants of health. I'm learning about some of these non-traditional things that you may not interact with in your official schooling or even in some of your or clinical areas. And I would love to hear from you guys, and I would love to hear any questions that you have. There's no stupid question, I promise. If you want to ask questions about anything at all, I would be happy to answer, whether that's, local work, humanitarian work, what have you. So please, the floor is yours.
I was gonna say thank you so much for that presentation. It was incredibly awesome. Me almost being a year at Mets Empire, this is actually one of the most inspiring stories I have. So if everybody could just give her a round of applause, please say thank you, like for the amazing presentation. So we'll be having a Q&A. So you guys could just raise your hands or you could drop your questions in chat. And then Abria, I'll give you the option. Sorry if I pronounced that wrong. I'll give you the option so you could either answer the questions in chat or you could choose like hands that you would ask like that you want to unmute. Any questions that are showing out to you, or if you want, I could choose them for you, whatever you want to do.
Yeah, I'd be happy to look through the chat. Let's see. Um, okay. Thank
There
you.
are some people who are raising their hands as well if you wanted to
Yeah,
look
if
at
you
them.
want to go ahead and call them out, and I'll go through the chat and we can maybe like go back and
Okay,
forth.
sure. So my first person I see is Hafsa Fatma. I asked you to unmute. Okay.
Yeah, hi, Islam nurse. Your story was really inspiring and knows myself. And I would like to thank you for speaking about cancer. It's not something everybody does. And I felt really inspired. Now, I have got a few questions for you, so I'm going to go through them really quickly. So, what would a day in your life look like as an ER nurse? Like coming from somebody who's aspiring to be one.
Say that, ask your question one more time. You cut out a little bit for me.
Okay, so I asked, what is the day in your life will look like as an ER nurse for someone who's aspiring to be one?
A day in the life of the ER nurse, is that what you asked? Okay, so a typical day is you walk in about 15, 20 minutes before your shift is officially about to start. You go into usually a break room or a conference room type setting, and you basically do like a shift huddle. So the charge nurse will go over what the patient assignments are, where you're going to be. Every day is going to be different. So, depending on if you're trauma trained or not, you may be in the trauma room, you may be floating, which means you may be helping your teammates and not have a patient assignment. You may have a specific patient assignment where you have 3 to 4 patients usually in an American setting, depending on what hospital you're in. And the charge nurse will basically give you a rundown of the day. We have this many patients in the department, we have this many patients in the hospital, we have open ICU beds, or the hospital's full, we're holding patients in the ER. And you may be walking into chaos or you may be walking into calm. So you may be walking into stable patients, or you may have a patient on a ventilator that's going to be a one-to-one patient. So your job is to usually drink lots of coffee or, your thing of choice beforehand, and go in and just go in and be able to see kind of what the situation is. And the first thing I do is I try to log in and see, okay, who are my patients and what are their vitals looking like? Or, if I have time, just run through their labs real quick. you get report from the nurse that's leaving your shift, and they usually are able to tell you like, hey, this is your sickest patient. Go here first, lay eyes on them. And then my next priority is to go assess my patients and kind of see what I need to do. So for ER nurses, we have different tasks we do. We are either helping with bedside procedures, we're starting IVs, we're giving medications. And so really the job of the ER nurse is to prioritize, okay, what is going to be my most emergent thing? What do I need to do first? What can wait? And ER nursing requires a little bit of a type B personality sometimes. You have to be okay with doing a task, maybe leaving it half done, going to something else, coming back, or somebody, asking you to do something else in between. And that's not always comfortable for people, but you get used to it. Sometimes people realize that ER is not great for them and they end up going to places like the ICU. I did the ICU for a year and I learned so much. And I think my ICU colleagues are absolutely brilliant, but I am not type A enough to work in the ICU full time. So I ended up coming back to the ER. I still pick up there and I think it's amazing learning, but ultimately, yeah, the ER does require a lot of adaptability and flexibility. The more flexible you are, the easier time you will have in the ER. But yeah, that's kind of a rundown of a basic day. But again, every day can be different. And we do 12-hour shifts here. So
Yeah, thank you so much. I just have a few more questions. I'm gonna be really quick. So about your Visa experience, did you experience any language barrier, because of the Arabic speaking people, and how did you solve that?
yeah, I did actually. So I don't speak any Arabic at all. I'm Pakistani, so I speak Urdu. And I relied very heavily on translators there. So Gaza's population is actually, they have a literacy rate of 98 to 99% in their last census. They are extremely well educated. Most of them speak English. So we did have dedicated translators. There were nursing students, medical students, dental students that, were out of work and unemployed or were out of school. And so they were doing a phenomenal job translating for us. So yeah, I don't speak any Arabic, but we had great translators and we were able to get by. Google Translate also, they're very proficient with that. And so we were able to use that to communicate as well. And it wasn't as big of a barrier as I thought it would be, honestly. And actually, I had a language barrier in Pakistan too. So I was going to Pakistan thinking, oh, my Urdu is phenomenal. I'm going to be awesome at this. And I show up and find out that in Savat, everyone speaks Pashto and only 5% of the population speaks Urdu. So that was a wake up call for me. And again, we had phenomenal translators that helped us there. So it wasn't much of a barrier there again. I think it can be a barrier
Yeah,
when you're trying to make an emotional connection with a patient. But as far as clinically, it wasn't.
yeah, thank you so much for your answer. One last thing, physical impact of nursing and any advice you have for somebody pursuing the nursing thesis.
What was your first part of your question? You cut out again, sorry.
I asked about like the physical impact,
Oh,
nursing
physical
and
impact.
having 12-hour shifts and being on your feet all along, and
Sure.
any advice for somebody pursuing.
Yeah, physical impact is definitely there. The ER is a very physical job. You're moving patients, you're, running around, you're on your feet. Good shoes are a must. Number two, again, you should work to live, not live to work. So, making sure that you're taking care of yourself, which I didn't always do. I would work very long hours. I wouldn't sleep well. I wouldn't eat well. I wouldn't work out. And I learned that the older I got, the more and more important those things got. So, the best thing you can do for yourself, if you don't already, is take very good care of yourself because that's the only way that you're going to take very good care of your patients. So, it does take a physical load on you. But, as somebody who has two back fractures, I am fine. Alhamdulillah, like I still am able to do everything normally. I did a lot of physical therapy and you just have to take care of yourself and it is totally doable.
Thank you so much.
You're welcome.
Perfect. And then also we do have a break at 12 o'clock, so just make sure to ask like 1 to 2 questions. That way everybody has a chance of asking. And then you could choose the next question
Sure. Okay,
from
so I
the
see in the
chat.
chat, is there any fundraisers or GoFundMe's that we can support? Yeah, so there's a couple phenomenal organizations, Palestinian American Medical Association is great, Heroic Hearts is great. Those are two medical associations that go to Gaza and other war zones as well that you can support. And I can send the organizers a list of other like verified charities that you can support as far as medical supplies and things like that. The best way to support. Yes, the best way is to advocate for an apartheid-free state. You are absolutely correct. Let's see. Thank you so much. I wanted to ask, how do you deal with balancing empathy while staying emotionally strong, especially in war zone settings? So, ER nurses are really good at compartmentalizing things. Uh, Granted, Gaza was emotionally the most difficult thing I've ever done. It still continues to affect me today, which is why I continue to do advocacy. The only way to deal with some of these very difficult things that are going on in the world is to feel like you're doing something to change it, which, goes back to the political advocacy that I do on Capitol Hill to, stop the funding for these atrocities, et cetera, or to allow medical supplies and things like that. So really just taking care of your emotional health. And I'm going to keep going back to the fact that you have to have a robust support system, whether that's your friends, your family, having healthy hobbies and habits outside of work is very, very important to stay emotionally strong. Um, Residing really close to Dallas. I'll actually put up a contact slide so you guys can contact me as well. Feel free to reach out to me for clinical settings. I would love to help you with that. But also, okay, so really you have to cast a wide net to get opportunities to shadow. As a high schooler, it's a little bit more difficult than it is in as a college student. But can you guys see that contact me screen, by the way?
Yeah, we see it.
Okay, perfect. So really, it's to cast a wide net. Be persistent. Call, show up with your resume. Say, hey, do you guys need any help? Is there anything I can do? That is the best way. There are, different volunteer opportunities. There's different clinics. There are free clinics everywhere. Your county health clinic, your mosque, your church. There's all these different organizations. You just have to cast a very wide net and get in where you fit in, right? Any foot in the door, and then that opens opportunities to network for more clinical settings. Let's
I
see. I see
see.
a lot of things. Yeah, go
Yeah,
ahead.
I see Princess raising her hand.
Yeah,
She's
please.
been raising for a while.
Yeah,
Do you
yeah,
want
yeah. Go
to?
ahead.
Okay, so hi, good afternoon, Dr. Mohammed. So we actually read your paper, Caring for Women in an Active War Zone, in my psychology class.
Oh, that's
And
awesome.
yeah, so I'm gonna tell my teacher about this.
That makes
How
me really happy, actually. Thank you so much. Because when I was writing that, I was like, I don't think anyone's gonna read this.
yeah. So how did your experiences like serving in the wars like impacted by it? How did your experiences in Hurricane Harvey and in Gaza shape your perspective on global health, trauma-informed care, and the role of nurses in like humanitarian crisis?
Yeah, I think it was revolutionary for me because up till then, I was living in a bubble, so to speak, of a very high resource setting, and I was exposed to, like lack of health literacy and low income patients and things like that. But it just opened a whole new world of advocacy for me, how healthcare is a human right and dignity is a human right, and how my job is not to tell patients what to do, but rather to advocate for, again, harm reduction. Because a lot of the time with trauma informed care, we really have to understand again, how different communities are being affected because that is not going to be homogenous across the board. And so it's so important to step out of your one hospital and to see that different communities are dealing with different barriers to healing, essentially. So I would say it was revolutionary, and I would encourage anyone to volunteer and to do different things. Again, you don't have to go to a war zone. Even volunteering locally in different settings is beneficial. It opens up your mind a lot to how to respond appropriately in those settings.
Okay, thank you.
How does one get into field work required for going on these humanitarian missions was one of as a pre-med student. So actually, Imana, the organization that I went to Pakistan with, we did have a pre-med student on our mission who went with us, and he wasn't allowed to do any kind of clinical work because he didn't have a license, but he did a lot of the social media work for us, and again, like was able to interact with the patients and the staff. And again, I would say cast a wide net. There are amazing organizations out there. If you just even, Google some of these volunteer medical missions, put together a good resume and, be persistent. Part of the reason I got to Gaza was because I was persistent and I kept emailing and I said, hey, I would love to go. I would love to go. I would love to go. And I made it almost impossible for them to ignore me because I was emailing them every 3 days about wanting to go. And so just really, put a good resume out there and really show that you're wanting to help and be of service in any capacity and go in with an open mind because again, this pre-med student did social media work for us, quote unquote, but learned so much because he was able to kind of interact with the patients there. Um,
Okay, so the last question, I see Emily Nivis. Sorry, she's been
yeah,
raising her hand for a long time. Do you want to
yeah, for
answer
sure.
hers? Okay.
Absolutely.
Hello, Nurse Mohammed. So you mentioned earlier about having a good communication with patients, making sure that you respect their bodily autonomy throughout the entire process. What can you advise future physicians on how they can help nurses achieve this goal, not just nurses doing what you recommended?
Yeah, so a lot of the time I find that patients when the physician is in the room specifically are nodding and smiling and saying, "Yeah, yeah, I understand." And as soon as a doctor walks out, they look at us and they're like, "What did she say? And what does that mean?" And people are in a situation, especially in the ER, where they are scared, they're anxious. It might be the worst day of their life, and processing even basic information becomes difficult because they're under that stress. So, I would encourage future physicians to just take a pause and to spend that extra 30 seconds to sit down to be at eye level with the patient. It's just these very small things that make a big difference in creating that patient rapport and that trust and not using, what we call doctor speak or nurse speak and just talking to the patient with very basic simplified terms and then following up with asking them what did you understand of that? Or what questions do you have for me? And opening that up and having them reiterate kind of will help you understand any gaps in their learning. But yeah, just taking that time to make that connection with them and trying to figure out where the barrier is and being able to make that eye contact with them. Those little things go a very long way because that's really all nurses do when the physician walks out. We're like, okay, what did you understand? How can I help? What questions do you have? And then the patient will kind of open up to that. So just spending that extra little bit of time, you're going to feel rushed. There's a lot of things going on, but nothing replaces them hearing directly from you what's going on with them and what choices they have in their care.
Thank you
Okay,
so much.
so we're now gonna start our break in 1 minute, but before we start our break, I'm gonna send out the attendance form and just please make sure you fill this out. That way your session is marked. And then if you guys have any questions, feel free to contact her. Her contact information should be on the slide. It's also in the chat. And it will be posted via Slack and on YouTube. You're more than welcome to stay if you want to. We're going to take the 15-minute break. If not, if you need to get going, that's perfectly fine. We want to appreciate you so much because your story was very inspiring. I really loved it.
Thank you so
You can
much
do
for
all these
having
things
me.
in the chat, of course. I'm going to send the attendance form now. So if you guys could just fill that out, please.
Yeah, I'm
And then
happy to stay on if you guys have the time allowance. And if anybody has any questions, I'd be happy to answer.
okay. Yeah. So you guys are more than welcome to close your cameras, meal, go for a stretch or go for a walk, get a cup of water. We're gonna go on a 15-minute break. And just please make sure you fill out the form once again. Thank you.
And yeah, please don't hesitate you can email me, DM me. I'm pretty accessible. I would be happy to answer any questions. Part of the reason we do this is to give you guys feedback. And I know that with these presentations, it's a lot of information and it's a short amount of time. So, we'd be happy to answer anything. And feel free to, if you guys are still on or have any questions, you don't have to raise your hand. You can just ask because I can't see all of you.
I can help take some questions that are remaining in the chat. Let me just scroll up. There's
Yeah, sure.
lots of thank yous.
Yeah, I think there's a few people I see that have their hand raised that are still on.
Yeah, while I'm scrolling through the chat, we can go ahead and take a question from Shoria next.
Right. Hello, that was such a great talk. It was so inspiring and it was incredible to hear all the work that you've done and what you saw in like the Gaza nurses. I thought that was amazing. So my question was like, what advice do you have for high schoolers who want to advocate for these kinds of causes? Like, what do you think is the best way we could do that?
I think that everyone has a role to play, and I think that you should do what is in your capacity and you should lean on your strengths. So as a nurse, I have the privilege to be able to go on these missions, right? You in high school may not have that privilege to be able to do that yet, right? So, what strengths do you have and what can you lean on? So, just because I'm a nurse doesn't mean that healthcare is the only capacity. Especially with these social justice issues or even like patient advocacy, human rights issues, you have the ability to channel your strengths. So, artists, writers, there's a niche for everybody. So I'll use Gaza as an example, but this is universal, whether you're talking about Sudan or Pakistan or any other place. Um, there are artists in Gaza. There are writers in Gaza. There are high school students in Gaza, right? I promise you that whatever capacity you have, those people exist elsewhere in the world as well. So really lean on those things and try to get involved with things that lean on those strengths. So, I have friends that again are writers and they're doing op-eds and they're, doing research and they're contributing that way. If you're an artist, they're getting plugged in with artists in Gaza and trying to support them that way or sharing, if you are from a background where you are able to donate financially, donate financially. Advocacy isn't something that is homogenous and a one size fits all, right? So you should do what is within your capacity and whatever strength that you have and get plugged into local organizations. I promise you that there are like-minded people in your high school. There are like-minded people in your community. If a club doesn't exist or if something doesn't exist, create one. Don't be afraid to be that trailblazer to say, hey, I'm going to make a, hygiene kits for Gaza club or what have you, and then start from there. Or, human rights for Sudan club and start from there. Like you can do something within your community and you will find like-minded people that you can bounce ideas off of and kind of get further in that sense. But yeah, I would encourage to lean on your strengths and try to find like-minded people in your community.
Thank you so much.
All right, I'll take a couple more. I'll definitely pause this by 12:10 just so everyone has 5 minutes to transition, but I'll take a couple more questions. So another question from the chat says, thank you so much for the presentation. It was very eye-opening and inspiring. My question is, was there any time you had to make a difficult decision and how did you handle it?
Yes, constantly. There are times in our settings in Texas and Dallas and Western settings or developed settings where we, are sometimes at odds with patients not wanting to do certain recommended treatments or physicians maybe where we're not on the same page with nurses picking up on certain things or there might be a communication barrier with your peers and working through that. I think sometimes it can be difficult when you are trying to relay something that the patient is going through and the physician may have a different perspective and trying to bridge that gap, and communication and rapport really comes into play there where you lean on that. As far as global health, constantly there are difficult situations. In Gaza, we had really difficult situations where we were having to walk away from children, from people that patients that would have had a absolutely chance at viability and they would absolutely have survived in a high resource setting, but we were having to walk away from them and they would ultimately die because we didn't have the resources, we didn't have the ventilators, we didn't have the supplies, or we knew that they had an inoperable condition that we just didn't have like a neurosurgeon to treat. But in a Western setting or in a developed setting, they would have survived because we would have had that specialty, we would have had that tool. And so those were extremely difficult situations. Disaster medicine is extremely difficult. COVID was extremely difficult because you had X amount of ventilators and, 20 people that needed that ventilator. So we were making really difficult decisions. So yes, that there are constantly difficult decisions in healthcare, whether that's local or global, but just kind of leaning on, again, harm reduction is what I would keep going back to and working collaboratively with your team to try to make the best decision for the patient in tandem with them, of course.
Thank you so much for that thoughtful answer. Okay, also so sorry if I mispronounce anyone's name, but Dilismari, you can go ahead and unmute and ask your question.
Thank you, and you said it great. Uh, First of all, it was incredible hearing about your story, and thank you for the work that you do. And the presentation was amazing. So I've been a volunteer at an ER, and I've loved the dynamic, and I've seen how stressful and how over how
All over the place.
interactive everything. Yeah, it's all over the place. And I can't even imagine how that would be outside of the controlled environment, and especially in a war zone. So that must be very intense. And I was wondering, I've also seen how all the dynamics, how everyone already knows how each person works and what they expect, or they have very easy communication because they know each other. So when you guys are doing these trips and this global humanitarian work, how diverse is the team in both culturally and professionally? And how do you guys prepare, especially professionally and personally? How do you prepare? And what gaps do you think there are in those in that work that goes to those places?
That's an excellent question. So it's similar to the ER in the sense that every day when you walk into the department, you're working with a different team. It's never like the set team on a set day, right? So you may know your colleagues, but it's going to be different colleagues every day. So global missions are similar to where you usually have a day or two to acclimate and to meet each other, and specialties are varied. So we were in a clinic setting in Pakistan, but it was me, an ER nurse, and an ER doctor and a med student. And we were supposed to have an internal medicine physician, but she had a family crisis. She wasn't able to go. So that day or two of acclimation is really all you get to be able to say, hey, this is my background, and be able to communicate. And it's just like the emergency room where you may not have the same personality as everybody, you may not be on the same page as everybody, but you have to be on the same page when it comes to the patient. We may have very different ways of dealing with things, but just to be able to say that we have that communication amongst each other. That acclimation day was the same thing we had in Gaza. We had, I think, 16 people on our team. We were very blessed when we went to Gaza. My team specifically had a lot of different specialties, but just learning to kind of trust one another in those situations. In those situations, it comes very quickly because you very quickly understand that if you don't work cohesively, it not only do you get frustrated, but it doesn't benefit the patients, right? So you have to be on the same team when it comes to the patients. And so I think part of being a professional is kind of putting aside any kind of like personal differences and putting aside all of that to kind of say that, okay, we have a common goal. We're here for 5 days, we're here for 2 weeks, we're here to do a job, and we're going to do it to the best of our ability. And overwhelmingly, I have found that people that do humanitarian work are very humble. They are very much there to do service work and to provide, healing and to learn. And so I think that those overarching common goals are there, and that makes it easier. But yeah, you do get a day or two of acclimation, but you very quickly are kind of thrown into a situation where you're like, okay, sink or swim, and it always works out because again, you realize that your patient is the common goal there. So it is just figuring out, okay, where is the stuff and how do they want us to do it, and talking to the locals and letting them kind of guide you on, they're the experts. This clinic that we worked in Pakistan, they operate that clinic 365 days. We just go in 4 times a year with medications and try to help out. So really leaning in on like, I'm not the expert, the locals are. They understand the culture, they understand the dynamic, and just asking them like, hey, what would you guys do in this situation is supremely helpful.
All right. Thank you
Thank
so
you.
much, Abira. If anyone is still in the call and would like to give another round of applause or reacts, we appreciate you also taking the extra time to answer some extra questions. Um, and we'll go ahead and let you go.
Thank you so much for
Thank
having
you
me. I
so
really
much.
appreciate it.
Yes, thank you.
Take care, guys. Bye.
Thank you. Bye. All right, guys, we're gonna slowly transition into our next speaker. So if you haven't taken a break, taken a sip of water, need to use the restroom, please do so now.
Yeah, I'm trying to
If you're trying to stop sharing your screen, you could go on Zoom. It should be like an app browser. You're on Mac, right? It should be like an app browser and you click stop sharing. Hello, everybody. If you guys could just start returning to your screens, we do have 2 minutes left of the break. And then Camilla will be hosting the second part of the session.
Hi everyone, welcome back. Hope that you all are back from your break. We're going to continue with our second guest speaker, who is Lauren Means. She is an assistant professor with a PhD in educational psychology at the University of Virginia Curry School of Education. And she is a former assistant director of the White House Initiative on Educational Excellence for African Americans during the Obama administration. We are so glad to have you here, and thank you very much for giving us the opportunity to have you as a guest speaker. So if you want to go and share your screen, we are going to get started.
Good afternoon. So excited to be here. Congratulations to everyone for spending and dedicating this time to really think about what this looks like. So, just as the introduction, I am a developmental psychologist. I am a professor at NYU, and I was formerly assistant director of the White House Initiative on Educational Excellence for African Americans during the Obama administration. So I want to talk a little bit about my journey and then talk about some of the work that I do. And I thought we could kind of go through this process. And so I didn't really know, to be honest, I didn't really know what the role of a developmental psychologist looked like until I became one. um, okay. So again, it is such a joy to be here with all of you. I would be remiss if I didn't say that your future is super bright and your career possibilities are endless. And I hope that these days are going to be super fruitful and exciting, and you leave feeling invigorated. So what I would love is if you could put in the chat what your just your kind of your name and what you're passionate about. So I am Dr. Mims, and I'm passionate about supporting Black children's mental health, learning, and well-being. So if you want to put some of your answers in the chat, I would love to learn a little bit more about what you are passionate about. Amazing. I love these. Thanks so much. Okay, cool. Women's health. I hope everybody's looking in the chat. These are so cool. Okay, I saw a little psychology. Shout out to my psychology folks. Okay, youth advocacy, disparity, stigma. Amazing. Amazing. Keep them going. Okay, so I think this statement is so important. Hold this statement close. I think sometimes we do personal statements when we're thinking about applying to college and then we don't look at them again. But like, put this somewhere. I had a post-it note right on my mirror that said kind of, I am passionate about, this is what I want to do. So really thinking about this, why are you passionate about it? And remembering, because it can be really, this field can be really difficult. amazing. I'm going to keep reading them, so please keep putting them over there. So I'm going to start about talk a little bit about my journey. So I started on the pre-med track. I wanted to be a pediatrician. I had always been super, super interested in looking at brains and neuroscience and really supporting people. And so really thinking about pediatrics as a space to be really supportive for families. As you can see all the way over, that's me in high school with a pink lab coat, like pink lab coat. Amazing. We were looking at, we were doing fingerprinting with my friend. As you can see in the center, that's me. I ended up actually majoring in psychology on accident. I went in knowing I wanted to major in English. I've loved writing, specifically creative writing. And I took a psychology class because I had an option to and fell in love with it. I didn't think I would ever become a psychologist, y'all. And that's me graduating with my best friend, Lynette. She ended up having stage 4 cancer and passed away a bit shortly after graduation. So that was one of my favorite days, is that I worked really hard to work with administration to make sure that she could come to graduation. And that was one of the last things that she did. So that means a lot to me. So this major in psychology, here's what happened, y'all. So I took a child development class. If you are an undergrad, highly recommend taking a child development class if in psychology, if you have some electives, because it was really great. And so I looked at child development and really thinking about, there was one small point in a lecture where I learned about the Clark-Doll study. Has anybody heard about the Clark-Doll study? So the Clark-Doll study was looking at preschool children, and it was and what they asked them is they said they asked a bunch of children of different races. They said, which is the good doll and which is the bad doll? And so what they did is, yep, exactly. It's like a very old study. And so they asked which ones were the good doll and which ones were the bad doll. And what they found is that many children said that when they pointed to the dolls based on skin tone, they pointed to the darkest doll as the bad doll and the lightest doll as the light doll. And so what they said is this actually led to the school desegregation movement. And the idea is that they said that if we separate children from others of similar ages, then they might feel inferior due to this psychology study. And I was like, whoa, a psychology study actually shaped policy, which then shaped all of these things. So yes, exactly. There's a small video. So I'll show a really small video here.
Ready, set, go.
Our second major finding, even black children as a whole have some bias toward whiteness, but far less than white children.
Show me the smart child. And why is she the smart child?
Because she is white.
Okay. Show me the dumb child. And why is she the dumb child?
Because she plays.
Well, show me the ugly child. And why is she the ugly child?
Because she plays.
Show me the good-looking child. And why is she the good-looking child?
Because she likes skinny.
And show me the skin color you believe most teachers think looks bad on a girl.
I don't think they think it matters. Because I think each teacher wants to help a student learn either way what they look like. And it doesn't matter what you look like on the outside, it just matters what you look like on the inside.
Show me the good-looking child.
They look the same.
Yeah? Show me the child you would like as a classmate.
All of them.
You like all of them as classmates? Why do you say all of them?
Because I don't really care what color they have.
This 5-year-old girl.
Okay, so as an aspiring psychologist, there's a lot there. I saw a lot when I was an undergrad. You see some kids who are saying that they have some kind of internalized messages on understanding and thinking about that darkness might be related to less beautiful or more, increased marginalization, where some kids are like, how can I tell from this picture which teacher, what the teacher would like? How can I figure this out? And so I was like, this is really interesting, but really important, because we don't want children to feel like because of the color of their skin, to have lower self-esteem. And so I was really that's how I started my journey as a psychologist, was really thinking about, this is so fascinating to me that kids can have different different perspectives. When we do this small study, we get a small window into understanding how children are learning and developing and trying to figure out, who am I and what does it mean to be me? And this is important because we know that self-esteem is related to your academic achievement, it's related to your mental health, it's related to your physical health. So we want kids to feel good because it really supports their mental health and well-being. And so I was like, whoa, this is so cool though. Like Mamie Clark and her study with her husband led to shaping this kind of banning of segregation in schools. And this is a psychologist. And I was like, wow, this is a really impactful career. Like I could do some really great things by learning more about kids and then helping kind of change the world. I was like, oh, I'm in. But here's where, now stay with me. So I then started doing a lot of research because I really wanted to know what are these differences that we see in the responses that children are giving? How are they giving these different responses? So how can psychology help us answer this? So Dr. Margaret Spencer Beale, she was also interested in the doll study and she replicated it. So what she did is in the south side of Chicago, she went to 6 preschools and worked with 130 Black children. And what she did is she did the racial attitudes and preferences that you saw, where they point out the dolls, but she also added measures of self-esteem, social cognition, and interpersonal confidence. So how they feel, how they're thinking about the world, and how confident they are in kind of making their way along in the world. And so what she found is she did find that children can have a bias against the color Black and Black people, that they were more likely to have supportive and say kind of when they were working on white and white people. But the difference here is they were able to maintain a healthy self-esteem. So this is neurological, it's developmental, that in the preschool years, kids are egocentric. They're really thinking about kind of self-centered. And being self-centered actually protects them from internalizing the negative feelings associated with learning. So when you see in the video gets even more complicated because there's a difference between being able to report what you observe, but not internalize those feelings. That was new. And that's in complete opposition of what the Supreme Court had inferred. So this is really, really interesting, right? And so this idea here is we can think about, okay, so they may be hearing in the world that there's some bias and discrimination in the world. And so when they're asked that question by a researcher, they may be reporting, but they might not be internalizing and saying that they feel like they are ugly because of their skin color. So there's two different things. This is like a very kind of complex psychological problem that I was really, really interested in. Oops. So then this idea is thinking about that children may have the ability to report things without internalizing them. When we internalize them, then we have mental and physical health problems, and we don't want children to have that early. And so, but if they're just reporting it, there's some time to intervene before they recognize what the world thinks. They internalize that to think about what I think about myself. And so what I found is thinking about as a psychologist, I want to help kids make meaning of those messages and say, that person said that thing, but I don't believe that about myself. I can still keep a strong sense of self-esteem that is protective for my mental and physical health. So then the question I looked at is then thinking about how can we help youth cope with all the things they're hearing in the world around them? How could we support their ability to thrive and be well? So I really wanted to look at who are they talking to? What are they learning about themselves and the world around them? When are they learning these things? Where are they learning these things? What are the messages they're hearing from teachers? Are they supporting them, or are they hindering their ability to develop and be their best selves? And why are they in these environments that are supportive, or why are they ones that are in kind of maybe toxic and lead to detrimental life outcomes? So in undergrad, I developed a program for Black girls in high school, and I wanted to create a space, a mental health space where they would thrive. And so we talked about some of the messages that they heard in their world, and we processed them so that they could feel like even just because I heard it doesn't mean that I have to internalize it. So they might hear some things like, oh, somebody said I couldn't do it. But I know through my program that just because you said I can't do it doesn't mean I can't do it. And so thinking about the difference between what the world says and what they feel about themselves. And so kind of building that identity building so they have strong, positive, healthy identities, which we know lead to positive life outcomes. So these are my mentees that I did from my program in undergrad. And so at that point in time, I had moved from pre-med to really thinking about psychology. And so I ended up getting my master's in child development focused on developmental psychopathology. So youth who have kind of the greatest need. So maybe kind of trying to cope with depression and anxiety in their world. How do we support their learning and development? So as you can see, there's me in front of Tufts, where I went to Tufts University. It's in Massachusetts. And then you can see over on the right, you can see me in that green sweater. I went around Massachusetts and I did home visits where I talked to families about the ways that they supported their children's learning and development. I would get in the car and drive for hours and go to different places. And that was one place that I went to go talk to families about what was supporting their ability to support their children. And at this time, y'all, I still really wasn't, I love psychology, but I wasn't sure what job. So if you're loving psychology, there are so many jobs to pursue that relate to thinking about using psychology as a form of healing and liberation. And so I thought a bit about if folks have learned about a child life specialist. So often there's a profession where you can support young kids who may be going into surgery or maybe in the hospital. You can help them by providing coping skills, by teaching them about medical procedures, and you can just kind of be a lifeline and support for children in the hospital. So child life specialists are amazing. I would look up at that career if you haven't already. I thought maybe I could be a clinical psychologist where I could really deliver therapy in one-on-one or group settings. But I also really thought I love research so much. So maybe becoming a professor where I can do research would be something that would be really important. And so just like in undergrad, I developed another program. And this time I made it a research study. So I had a pre-evaluation and a post-evaluation, and I saw really amazing change after 8 weeks. The children who had the students had said, or the principal had said, work with students who have a 2.0 GPA, a 2.5 to a 2.0 GPA, and really kind of support them. We would love to support them to think about staying engaged in schools, doing better in school, and feeling better about themselves. And that's exactly what we found. After 8 weeks, they attended school more often, their grades were better, and they felt more like they were part of a school community. And so that was really powerful to really think about using, creating settings for kids where they really feel nurtured and supported. And so then I decided that could be really cool, like being a clinical psychologist, creating group therapy settings in schools. But there was one experience where at week 7, so when you do a research experiment, it's very controlled. And so you have a pre-experiment, or you have a pre-test and a post-test, and you follow people over time. This was week 7. And when I looked out the window, I saw that there were 4 girls who were standing outside watching the program from right into the windows. Like you could see the program going on through the windows. And they asked me if they could join. And I realized that if I let them come in, then that might shape the results, right? Because they haven't been in the intervention for all of those weeks. And so I couldn't let them come in because I was collecting data. And so I thought to myself, though, well, if I go into something like school psychology or clinical psychology, there might always be someone looking in the window. And so I thought, but if I could work on research, then I could think about this idea of like, if I created research and I had these really great ideas, then that research could be disseminated and shared to all teachers. And then maybe teachers could create their own programs for young folks, and it wouldn't have to be me doing that. And so I was like, oh, I could work on creating national school programming. And then I could think about, oh, well, maybe some of the policies that I saw that were causing some harm for children, I could think about changing policy. That could be really cool, change national policy. And then I could teach teachers and teacher training and create new theories. And I was like, this big dream. And so I'm in my master's program. I'm like, this is it. I'm going to be a professor and I'm going to do research and I'm going to do policy and I'm going to do programming and I'm going to do training. This is going to be amazing. So I took all of these really brilliant ideas over to the internship supervisor and I said, I want to do all of these things and it's going to be amazing. And I was so excited. And you know what he said to me, y'all? He said, that's so nice. That's so nice. But your dream, this dream you're so excited about, is like climbing Mount Everest. It's virtually impossible. You're not going to be able to do all of these things. I was crushed. I was crushed. Imagine hearing this. Like, have you ever had someone who has said that your dreams are too big? I'm sure that some of you are there have heard that your dreams are too big, and it's really, really crushing and it feels awful. But because we don't have a lot of time, I get to kind of skip to the good part. A year later, Tufts University gave out awards, and I received the Top Research Practice Integration Student Award. And guess who had to hand me that award, my friends? Guess who had to hand me that award? Guess who had to hand me that top student award? The same person who told me that my dreams were like climbing Everest had to then give me the top student award, because what I told him is that actually people climb Mount Everest every year. And so if I put in the training and the work, then I think I could be one of them. Sometimes you have to prove people wrong. Not everyone is going to see the vision that you have for your life at the same time that you see it for yourself. So I applied to PhD programs after my master's, deciding I wanted to be a professor. Remember, I wanted to do research and training and practice and policy. I had big plans. So I received my PhD in educational psychology, applied developmental science. So I got a twofold degree, both in educational psychology and developmental psychology. My work is heavily mixed methods, and so I am both a qualitative and a quantitative scholar. And so here's where it gets fun. Here's where it gets fun. So back when, during that time, Twitter was amazing. And I think all of you might relate, because how you found out about this program, maybe it was from Instagram, maybe it was from Connection. But back when Twitter was really big, I had a Twitter account. And the Obama administration used to tweet a lot. And so I used to tweet. The Obama administration used to have these chats where people would talk about certain issues. And so every single month, I would prepare for this chat around a topic. I would write down my answers and I would be really, really nervous. And then I got a direct message from the White House. The White House was like, we really love what you've been saying online. We think that you have a really great vision. You should apply to our internship program. So I applied for the White House Department of Education internship program. I interned for the summer and I said, I'm going to be the very best intern that they have ever had. If they want me to staple things, then I'm going to staple things. But I'm not only going to staple things, I'm going to staple things before they ask me to staple things. I'm going to make myself invaluable in this role. And so I started thinking about, I would look at the schedule for the director and see what the director had going on. And I would prepare memos about the next meeting that he had to prepare for, even before he told me. And so I wanted to make myself to be the best intern I could be, even just if I felt like I wanted to be a memorable intern. And so on the very last day of my internship, he said to everyone, oh, let's shake my hand. Thank you so much for this internship. And I went up to him. I was the last person. He said, oh, you don't need to shake my hand. And I was like, oh, this is embarrassing. You don't need to shake my hand. I was like, oh, was I so terrible of an intern that you didn't want to shake my hand? He was like, you're not going anywhere. That's why I don't need you to shake your hand. And I was like, oh my gosh, what? What do you mean I'm not going anywhere? I'm supposed to go back to my PhD program. I'm supposed to be doing things. This was supposed to be a summer internship. And then all of a sudden he was like, yeah, no, you've been amazing. I can't imagine running this office without you. And so he was like, I'm going to work some things out and I'm going to see how this works. And so I went back to my PhD program. And then at Christmas, they found a senior staff appointment. And all of a sudden, I left my PhD program. I took a leave of absence and I was turned out to be assistant director of the White House Initiative on Educational Excellence for African Americans. And in that role, I started focusing, going across the nation, talking to students all over and asking them what they needed to be supported and successful in schools, and then working with the school professionals to create policies and programs that would support them. And then I would also do things like bring kids to the White House, and we would screen films. Like we would screen films and then afterwards have conversations. We would do things like have reading parties to support early literacy. We would have programs to support students with disabilities, and we would bring in different folks to talk about how to support students, Black students with disabilities in schools. And all of a sudden, I'm swept into this amazing White House world. And again, remember when somebody told me about Everest, like, you have to keep the vision. There's no way I would have known that I would have ended up being an appointee in the Obama administration. But I showed up every single day and told myself I'm going to be the best I can be and hope that that leads to something really cool. And it did. So on Inauguration Day, when President Trump was in office, I was driving with a U-Haul back to my PhD to go get my PhD. So I received my PhD and I started my journey as a professor. And as a professor, I've been really focusing on thinking about how we can partner with Black youth, family members, and the community to develop this roadmap for thriving. So that's what I've been really, really focused on for gosh, I actually just moved from assistant to associate professor. So I just received tenure. So I've been doing this for, this will be my 7th year as a professor. So I want to show, just as we're kind of doing this, thank you. Y'all are so nice in the chat. You're so sweet. I'm glad I just love sharing this story because this story is unique, but it could be your story tomorrow. I just, you have to show up for your dreams. So I want to show some examples. So now as a psychologist, what I kind of really focus as a developmental psychologist is focused on young people and thinking about creating pathways to thriving. So one thing that was really, really, really impactful for me was some research that came out that the rates of suicide for Black youth increased 73%, y'all, between 1991 and 2017. Black youth between 5 and 12, they're 2 times as likely to die by suicide when compared to all other ethnic groups in the US. And for Black girls, and specifically from 2001 to 2017, the actual suicide death rates increased 182%. And so that really, really, really impacted me. And so I started to think about, like, how can we build spaces to address health inequities to support Black youth? And so some of the things that we've been doing is trying to figure out, taking these solutions-oriented perspectives. And so what we've done is we've done a big study of all the research published in the past 10 years to find 6 things that really help Black children thrive in the world, and they prevent suicide. So the 6 things are things like mindfulness and having a positive self-concept. So going all the way back to Mamie Clark, feeling good about yourself can prevent suicide. Kinship support, so having family, and this can be chosen family, this can be birth families, that can be a protective resource that you can use. Collective socialization, so having peer and community support, having school connection, those things have been seen to prevent suicide. Black cultural identity, so feeling really strong about who your race and that it's important to you. Having hope. So we all know hope is so important. Having hope and meaning in life and having purpose in life, that prevents suicide. And then religious and spiritual coping can also help. And so what we're doing is we found these 6 things, and what we're going to do now is really focus on putting these into really thinking about how do we put these into interventions. And so one of the ways we're doing this is we received over $1 million from the federal government to work with a school district to look at their policies and looked at the practices in Richmond and really think about how can we design policies that promote mental health, which is so cool to partner with schools to figure out now, thinking about how do we take the research and make it actionable. So one of the things we did is we looked at the policy, all those boring documents. We looked at school board meetings, and we really tried to figure out what is the policies that we have and how can they better support children. So one of the things we found was in Virginia's Department of Education, they had an HB 40 that required all schools to have a mental health space. This was like kind of cool. So then we worked with youth to figure out how to create mental health spaces in schools. And so you can see at the bottom, that's them drawing mental health spaces. And we also found out that they required training for school staff. So we thought about like, how can we create, what was the training that would be helpful that we think would be really good? And so then we created some trainings that all folks could receive. So it was really cool to think about as a researcher. Sometimes we think that researchers just are like sitting in a lab all day, but like we were out in the community and we're working on creating actual mental health spaces that will be in schools, which is so cool. We're also creating new evidence-based suicide prevention tools. And so we created self-guided plans that people can follow, they can use during difficult times. And we've seen that that's been really helpful. And we're piloting a low-cost mental health intervention right now. It's called the Glow Up. And what we do is we send a box to families. And in the box is a bookmark and a book and some questions. And that's it, y'all. It's low cost. The book itself, like when you buy it in bulk, it's a small thing. And then we create questions that engage families in mental health conversations that can be supportive. So what I want you to do is you are going to kind of be my research team. I've got my notebook here and I've got my pencil. What I want you to do is you're going to watch a data collection video. We have permission from the family to share the video. As you watch, I want you to look and think about some things that you learned about children's mental health or supportive parent-child interactions. So just type away. And then I would love to hear what your thoughts are on this low-cost intervention. So as a reminder, we just enroll families in this. We send them a book. And then we have some prompts to talk about, to see if we can kind of engage them in conversations around mental health, because we know, going back again, that family cohesion and feeling good about yourself can actually prevent suicide. And we wanted to start really young because we know, when you saw those statistics, that kids as young as 8 have also had increased suicide rates. And so we want to think about young. All right, so here's the video. And you can just put things that you see that are supportive or questions that you have in the chat.
What emotion is that?
Yellow?
Yeah.
For who?
For Maya in the book.
Let's see.
What emotion is that?
Yellow?
Yeah.
For who?
For Maya in the book.
Happy?
Okay. Can you tell me a story about a time when you felt yellow?
Wait, does it say yellow?
It says, tell me a story about a time when you felt a yellow glow inside.
Oh, once when we were making an apple pie and it was ready just before we were sitting down for dinner, my grandmother secretly let me have pie before dinner and after dinner.
And that made you feel yellow?
Mm-hmm.
Okay. What emotions do you think Maya felt when she was filled with her red glow?
I think she was feeling frustrated.
Any other emotions?
A little sad.
Okay. Anything else? We'll go back
I
and
think
look.
that's it. Stop. Pop. 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 See?
Okay. Okay.
She's fine.
What kind of face is that?
Okay. She said my name.
Yeah. Yeah. You can close the book. Oh. We zoomed.
Hang on.
What emotion is that?
Echoing.
Oh. We zoomed in a little bit too much. On the questions. Okay. What makes Maya feel like she's filled with a yellow glow? Okay.
Yeah.
With a red glow. Let's not touch the keyboard, okay? So we just did what emotions. Can you talk about some of the things that make her feel red?
When her brother, the
Her
police, police
Let's
come
focus
when her
this.
brother when her brother bought her ice cream.
And that was her cousin. Okay. No, let's let go of the balloon, please.
Fine.
Okay. And when she found out, what about when she found out her favorite tree was going away?
She was very, very mad.
Mm-hmm. Maya glows red when she is super stressed. Stress is what you feel like when you are worried or uncomfortable with something or someone. Do you ever feel super stressed?
Mm-hmm.
Okay.
Once at school when I was doing a project, I was trying to do something like hard because I finished both papers because they were easy and it was really hard and I was really stressed and I had a red glow.
Okay. Did you tell anyone how you felt when you were that stressed?
I told my teacher and she helped me feel better by taking a few breaths and drinking some water.
Okay. So what else helps you when you feel that stressed?
It also helps you just hug it out and take some alone time.
So taking some breaths, drinking some water, talking it out, maybe having some quiet time, a big hug. Anything else?
That's it.
Okay. Sometimes Maya glows blue when she feels sad. Can you tell me a story about a time when you felt blue?
Well, once one of my friends was excluding me and they looked like they were playing a really fun game and I felt blue.
Okay. For some kids, they always feel blue. Some kids feel sad almost every day, all day long. Do you feel sad every day, all day?
Not every day, all day, but sometimes.
Okay. What do you do when you feel sad?
Sometimes I just take a long time and I just play something else.
Yep. And sometimes I noticed that you get sad at bedtime. And do you think that resting helps you feel better? Because you're sad at bedtime,
Yeah.
but then in the morning you feel happy again.
Yeah.
So taking that quiet time to get some rest, that helps.
Mm-hmm.
Okay. Near the end of the story, Maya's friend asks, "How do we take care of one another? How do the people in your life take care of and support you?"
It would feel good if they just if we all got together and did a community thing and we helped people.
Okay. So she's 7. So in the chat, what are some things that you saw? What are some things that yeah. So the colors and the emotions. Yep, kid friendly. Yeah, exactly. Identifying emotions, processing emotions, and then emotion management. Okay, Jaden. Exactly. Yep. Happiness, freedom, emotions and frustration, sad. Yep. Yeah. And teachers. Yeah, the role of teachers. That was a big one. Yeah, exactly. The intentional remembering of the happy memories, pointing out the emotions, relating, communication. Yeah, and these simple questions, right? Then she was able to connect the colors with her own feelings. Yeah, exactly. Identifying emotions. Yep. And then thinking about others, stress, strategies. Yeah, family, right? The role of family cohesion. Yeah, she was pretty good at stress, right? Hug it out. She was listing all the stuff. Yeah, readily identifying with the colors. Yeah. Yeah, and then the questions were both, yes, they were active listening, they were both comprehension, and then they were application. Yeah, she was super self-aware. Yep, depression. Yeah, yeah, I already got that, right? Like stress, using kind of giving them an easy way, an entry point. Yeah, yeah. So I feel like I think having that practice, yeah, yeah. Trusted adult. Yeah, and I think this is important. I think sometimes we don't think that little young kids are really thinking about these stressful experiences in this way. Yeah, and the mom's amazing. Yeah, and thinking about, oh, these are so good. Trust, can I, yo, wow, can I bring you all into the lab as research assistants? Because you are really strong. Yes, yes. Amazing. So those are some things that I saw as well. So thinking about possibly the importance of family dinner. She identified school related stress, teacher support, the role of kind of taking breaths, drinking water, mindfulness. So she's using kind of these interpersonal coping. She's talking it out. She's co-regulating. She's also has kind of individual alone time. There's also themes of friendship and exclusion, as well as thinking about community engagement. So then we might really think about, as we continue to get all of these videos, our goal is to kind of work with 50 families. Then we can watch across 50 families and start looking at some themes about, is familial co-regulation maybe something that is really important in the early years. School-related stress may be a main form of stress. Friends may be important forms of joy and stress. And so then how do we take this information and help families engage in conversations like this, as well as work with teachers and educators to help children continue to name and describe? Yeah, the communication, she's great. Yeah. Yeah, she's so great. Um, you feel yellow. Shout out to y'all. Good. No one's saying they feel red. But if you feel red, you could try talking it out, alone time, a big hug. She's really giving you the tools here. And then I'm gonna do one more. So this is Naya. I don't have the video for time, but we asked Naya what she did, and this is so cute. She said, what do you do when you're feeling sad, super super blue? And she said, do mood magic. And then Naya's mom said, mood magic, can you tell her, the researcher, what mood magic is? And Naya says, no, I'm shy. Naya's mom says, how do you describe it? Naya says, me, Naya's mom said, or you could tell me, how do you describe it? What's mood magic? And then she looks at her mom instead of the researcher and she says, mood magic is something when you go down and you close your eyes and you sprinkle pretend glitter on your head and you swirl it. Naya's mom said, and then what happens? Naya says, I feel better. And then Naya's mom says, yeah, so mood magic is when we close our eyes, we take a breath, and we sprinkle some glitter on our heads, and then we change our mood. So that's what you do when you feel sad. And I just love this quote because we're learning more about how families are supporting their children's ability to cope with big experiences. So that is what I have. If you're interested in psychology related fields, something to promote is that among adolescents who experience a major depressive episode, about 40% of them didn't receive mental health care. So the question I have, if you're interested in psychology and one you could pursue as your passion, is how can we craft a robust mental health ecosystem for all youth? So thank you so much for listening. I pretty much have the best job in the world, and I focus on promoting joy ecosystems to promote thriving. And so if this is something that you are interested in, then I want you to think about what this might look like. I'm here for M.D.s and but just think about those of us in psychology, might also be an additional role. So I'll end you with this cute video.
Last one. Thank you so much. If everyone could go around and give a big round of applause on Zoom. We really loved your talk. I think I speak for everyone when I say that it was pretty emotional and motivational. And that you give us all this perspective. It's really great for us. Thank you so much.
Good.
Right now, we are going to go with a Q&A. So I don't know if you want me to moderate it or if you want to moderate it by your own. It's totally your choice.
I'm happy to see the hands. So I see Ayana. Hi.
Hi, how are you?
Doing well. How are you?
I'm doing wonderful, especially after your talk. I feel great. I feel ready to take on the world now. So that's amazing.
That brings me joy.
Um, of course. I wanted to first thank you for speaking with us today. It was very insightful. It was entertaining as well. It was all around beautiful. I loved it. And I remember you mentioning an event that you put together when you were working under the Obama administration. And I actually read about that, the literacy event that you did for
Yeah.
I read about it was beautiful. I believe it was called the Princess for a Day, the Princess Reading Party for
Yeah.
Girls. I loved reading about that. It was so beautiful. And I believe it was led by a 6-year-old girl who had written her own book, and she was reading her book for all the girls in the at the event. It was amazing.
It was. I look
It
at
was so
you.
beautiful.
Thanks for
Yes,
seeing
you're
me. That's so
of
fun.
course, of course, you're an inspiration. That was beautiful. But anyway, my I believe when there was an article written by you about the event, and something you said was that when girls don't see themselves and their experiences and the stories they read during a formative period of their growth and development, they struggle with actualizing their dreams and aspirations. It is difficult to be what you cannot see. That was a bar. And then
Mm.
you proceeded to say it is our responsibility to our princesses that we speak their truths into power and affirm them until they know how to dig deep to find that empowerment for themselves. So, my question is, since hosting this event and writing about it, do you think society has done a good job currently of allowing Black girls and women to shine, whether it be through storytelling, the media, education, or simply for acknowledging their small wins? Simply, do you think we heard you?
Mm. Mm. I don't know. I think that that is actually it's interesting. Since then, my mm, undergraduate student did her senior thesis actually looking at representation and how representation influences Black girls. And she talked to 20 Black girls about what they felt about contemporary media representation. Do they feel like they're seen? Do they feel like and they talked about how there's some cool stuff. So Ada Twist Scientist, as you can see, I am a big fan of like media. And so books nowadays there's great books that have come out that have really focused on having different stories. So there's something called Not Quite Snow White, which is a great story. They also talked about that there are some different representations. So we see the Marseille Martins of the world, right? And we see the Yara Shahidi. We have now Lunella, and who really focuses on science, and we have some, but they really talked about that there needs to be more representation. And so we asked what they wanted to see, and they said, we love Misty Copeland. We want to see even more Black ballerinas. We want to see in every space that we're in, we want to be able to see representation of the world around us. So not, and what I loved is they didn't say just that they actually have to see representation of themselves. They want to see representation of other people. They said there needs to be more Asian American people who are filmed in the headlines of films. They need to see more people who have a different body size. They said that we see the same body size all the time. And so I think that I since then would say I don't feel like you can't be what you can't see. I would say now I actually think that you can be what you can't see, because at some point in time someone had to be that thing for you to be able to envision it, right? So like I think in my career, I didn't really see a psychologist that was doing the work that I wanted to do. And I think that I kind of created that role before I saw it. Like, and so I think now that you can't be what you can't see, I think I would change that. I think that it's easier to be what you've already seen because that pathway has been paved. But I don't think that that means that you can't be what you can't see, because I don't think, like, I started as pediatrician. I probably started as a pediatrician because we had pediatrician Barbie, right? we had we saw a pediatrician. how many times did you see a developmental psychologist? Most people probably didn't see a developmental psychology professor, right? Like you didn't see that. And so me kind of going into academia, seeing professors, but also not seeing the research I wanted to study, I had at some point in time to have a vision that one, I told you people didn't really understand. And so I think what I would change is actually what we can be, what we can't see, but it's important to have other people who believe in the vision that you have for yourself, because it makes it a lot easier. I think I probably would have been more confident in my career direction with if I had had more people believe in it. It was hard for a little while, and it was kind of felt a little isolating and scary. And if I think that young people, it would be really great if they don't have to do it alone, you know? Thank you so much for that one, Ayana. And shout out to you for reading the Education Post article. Like, you are MVP today. That was a wonderful question. And now I'm going to think about the Princess Party, because 100, and it was actually 100 Black girls who had been, who were currently homeless or in foster care. And that was also really important to us to have as well. And so kind of creating a day for them to feel like princesses, but not princesses like princess, like that type, but let's feel special. And also by championing literacy, and then having it led by a 6-year-old who read her book, like layers of fabulousness on that day. And I will forever remember it as one of my favorite ones. So I appreciate you, future Dr. Taylor.
Oh, stop. Thank you so much. I appreciate you for saying that. And I love that you were able to make that reflection about yourself, a past understanding that you had, but it's now reformed. That just shows your growth and just the amount of work that you've done on yourself. That's
Look, friend,
amazing.
the only thing constant is change. Like,
Re-
we have to constantly engage in self-reflection. There are definitely things I would do differently if I could do them again. But I think when I look at the balance of my life, I think constant reflection is just so important. So thank you so much.
Of course. And I just have one more question for you. I know I'm taking up so much time, so I'm going to make it fast. But
I'll answer it quickly.
I also read an article about you. Hi, I'm your stalker. But the article talked about your PhD dissertation titled "Meeting Black Girls on the Moon," and I was another amazing thing. But I wanted to talk about something you said, or something the article said, but it was a direct quote from you. But you said that we need to celebrate Black girls where they are, and that may mean meeting them as far away as the moon. I was so astonished by your boldness, and I was fascinated by that. But I wanted to ask, did you think there was a lack for celebrating Black girls where they are because we are often underestimated and looked upon as not having much to offer? Or do you believe this behavior stems from others, in fact, knowing our potential and worth, but wanting to hold us back because they're afraid of what we can do if they met us on the moon?
I love that.
I'm sorry, I know that was kind of loaded, but
No, it's a good question. It's a good question. I think I'm actually going to punt it to Toni Morrison. So I saw when I was in Massachusetts, when Toni Morrison was living, she gave a talk about good and evil. And what she said is, she said, actually, we give too much attention to evil and not enough to goodness. And so she talked, and the reason I bring this up is because I think I don't know why Black girls are frequently underestimated in settings. A part of the common thread that I've seen is that Black girls will be in schools and they'll be seen, they will be seen when, let's say, a pencil drops, and the teacher will look at them when the pencil drops. But when somebody when they have an answer, they don't automatically look at them for the answer. They look when there's a problem. And so that is something that we have seen and we have proven. So then the question then becomes, not necessarily, I haven't focused my career on thinking about then why they feel that way or why they do what they do, because I think sometimes that gives a lot of energy to to the evil of the world. Whereas if we look at the goodness, it's thinking about how can we know Black girls are in that circumstance, how can we support them to make sure that when they are never called on in school, they still feel like they can be strong responders and answer those questions. And they can say, even though that teacher doesn't see it, that doesn't mean that I'm not smart. And so I think that there's the kind of the roots of inequities, I think, are steeped, right? And we have such a history in the United States of bias and discrimination, right? And that's so entrenched in our society. And I think, how do we address that is a big question. But the other big question is thinking about, how do we create these pockets of supportive spaces for young folks where they can feel like they can be themselves? And I would love that from my dream, and I say this to everyone, is the moment a Black child wakes up to the moment they go to bed, how could they be nurtured and supported and valued? And think about, like, what they wake up and they get on the bus and the bus driver says, "It's so great you're here," all the way to when they're going to bed at night, they're tucked in and they feel great. That's not always the case, but I think we can think about different critical points by working with parents to think about, when you're in the morning, maybe you do morning affirmations. With teachers, you think about teachers, if your only time that you're talking to children is to reprimand them, then shape teacher behavior. We can work with policymakers to think about, what are the policies in schools that may be impacting kids? And we can just think about little kind of creating these ecosystems that can then be kind of supportive. That doesn't necessarily, I think it's like there's a twofold process. We have to decrease the problem behaviors and the harms for children. We also have to boost the things that are good. And so I think when we think about Toni Morrison and the badness of, or the balance of goodness and evil, I think part of my work has been really over on the goodness and less on the kind of what's wrong. And I think we have to do both. But I think one thing I've learned in my life is that we have to do both, but also you don't have to do both, right? Like there, which I have found that's maybe kind of a little liberating. I don't know if anybody needs to hear that, but like, you are going to have so many research ideas in your life, and there's going to be a lot that you could do, and we can't do it all. But together we can do more. And that was liberating for me, because people are like, why don't you do research on this? And why don't you do research on that? And I'm like, bruh, I am one person. I can do this, and I can reach out to other people who are doing this work and do that too, right? It's the idea of thinking about, we go further together. And so I think I have connected with people who really focus on things like working with kind of addressing racism, experiences of bias and discrimination in communities. And I can bring that in by thinking about also creating joy interventions. Okay, so that was really long, but Ayana, if you want to reach out, and for anyone who wants to reach out, it's lauren.mims@nyu.edu. Happy to send an email. I will say I'm kind of slow at emails, to be completely honest with you. I get a lot of emails, but I will respond to you. I promise. I'm just not that fast. Another one,
Thank you.
of course. The question over here is, can we start a program for students as undergrads? The way that I started the program for undergrad, so some of it is there may already be a program in existence. So just check and see. So at the University of Virginia, there was a Young Women Leaders program. And so I was a mentor for 2 years there. And then they asked me to create 11th and 12th grade programs. So I just kind of pushed onto the program to create 2 more years of the program. But you could also think about, if that's not possible, there's some mentoring programs that a lot of universities offer. And so doing some mentoring might also be helpful. But if you are interested in doing research project and think kind of creation of a program, you should, if there's not a professor that's available, then I would definitely think about volunteering with a program and just keeping a notebook of all the things that you would change if you were able to do that. And future Dr. Fatima.
Well, thank you so much for saying that. And first of all, my presentations, I absolutely enjoyed it. Made me feel like I stumbled on a same premium. And my favorite part about your presentation was the Mount Everest part. I was like, oh, what's the good, guys? And I was literally cheering here.
Yay!
So I have a few questions for you. Yeah. What you mentioned, like children facing bias, I have actually seen that on a very personal level. If you're in India, people are obsessed with their skin, and that affects children as well. So when children get tan, they are subjected to chemical treatments and remedies just because they're dark. So my question to you is, as a psychologist, how do you recommend approaching children who feel inferior because of their color, instead of straight up disagreeing with their insecurities that no, you're not ugly or something like that because then it invalidates their opinions. I tried using the purple shirt theory on my sister herself, but she kind of like told me that I am wrong. So
Hmm.
it is really embedded into her that she is not beautiful when she is dark. So how
Yeah.
can we change that?
Yeah, I think that that's really hard, right? Like colorism is a thing across the world. And it's not something, I think some of it is also like there can be really I students and young folks I work with, it can be really powerful to name what they're feeling and what they're experiencing. So instead of sometimes I think as adults, we sometimes do a disservice when we say things like, oh, don't say that about yourself. You're beautiful. They see things like advertisements, maybe for skin lightening cream, or that people, they see that they're treated differently because of who they are. And so, one of the best things and the most important things we can do is actually validate that society had there's this thing called colorism in the world where society has sometimes says that people who have lighter skin are more beautiful. That's called colorism, but it's not true. It's not true, right? And that people have this idea and this image that was created a long time ago, and we have to fight that because the things that are so beautiful about you, right? And they're not just your skin, but they're also the things that are within. And some of it is saying that like, but providing the language and actually addressing it and saying it is important, because some kids, then what we find is similarly to when we do work on experiences of racism, when you move it from they are able to also move from return reporters to internalizers, right? That's what we want. So if they can say, people treat me differently in this world because my skin is darker, and there are beauty standards that are wrong, that's different than they don't have a source of why they feel how they feel. And so giving them that source I found has been really helpful. And also, I think it's important to think about little micro activations. So we can't change the world yet. And thinking, I mean, I I would love to, and maybe one day we will. And I think when we have more representation and campaigning, I think this is really important. But I also think that we can have micro activation. So we can stop and we can be bystanders sometimes for folks in places where we're not going to, don't put yourself at, say, at harm. But if you see someone like who says, well, she's really beautiful because of her this, then you could say, like, oh, you are when you say those things to her, that might be really hurtful. It can, we should also affirm her beauty for how it is, because she's trying to develop her self-concept at this time, right? So as adult to adult, we can talk to adults and say, or let's, I noticed that there's not really any representation of people with dark skin in the books that she's reading. Are there books that you can find that would be something that she can read and learn about? It also can, the power of representation can just be so, so helpful. So I think the fact that you are concerned and thinking about this is important, and not enough. And seeing that other kid that she has support, that means a lot. And so it can be really hard. It can be hard because of the way that beauty standards are. And we can't we can only change the small ways in which we kind of can maybe support young kids and feeling like reporters rather than internalizers. I'm different and special in my own way. And those things, they might roll their eyes and not, but like at the end of the day, we want that message to be something that rings in their ears at the same time that they're hearing those others' messages. But they might not say like, oh yeah, they might dismiss it, but like at the right, like because they're little kids. But we know that that can also be something that they hear. So keep like just by noticing, I think noticing you're doing something really great. Noticing, recognizing, providing the language is really important. Also increasing representation, thinking about if there are particular movies or books or images of folks if she gets older, also there may be stories of folks who have kind of dealt with colorism and figured out their identity and felt like they're beautiful in their own way. It can be helpful to read, especially when it can be hard to talk about. So I think that this is talking about, I think, colorism. Somebody mentioned the brown paper bag right test and thinking about that. Those are all psychology has really focused on thinking about how to support self-esteem, and it might be also bolstering kind of their other things that make them great, right? We are more than just a pretty face. We're pretty and this, right? Like there are multiple parts of us. And so I just again want to just affirm you and say thank you for thinking about this. And I know that she's got people in her corner. So but start, I think,
Thank you so much.
yeah, power and naming and representation. I think those are the two really big things.
Thank you so much for saying that. I love how it is a solution is. And let's take a moment to address the suicide rates of children aged 5 to 12. Like, how heartbreaking is that? They are just, I was so shocked. I didn't know about this. And that was really heartbreaking for me. And nobody should get to go through that. But also, I feel like as a newer generation, as a more informed generation, we have more hope in, erasing racism and advocacy about colorism and everything. So, how would you comment on that? Do you think Gen Z and the future generations do they have hope on being a better world, a better united world?
Hmm. I heard there was a little bit that was missed, but I think thinking about hope, what does hope look like in this current time? Is that a bit of the
Yeah, I just asked about how do you think the coming generations would impact colorism and racism because we are a more advocating, a more
Mm,
educated generation compared to the
mm.
previous ones.
I love that. I mean, honestly, that's a good research question, right? I think that's the formation of a good, if you want to be a researcher, is asking, really thinking about how does this current generation think about some of the issues that have been things that that previous generations haven't been able to solve or address. What are some of those things? I love, like, I think TikTok is doing amazing work, right? And like representation itself is now like people are doing that. We see so many people who are pushing back against some of the things that we have always taken for granted. Because like, why are we taking these things for granted, right? Like again, going back, if we think the only thing constant is change, if you live by that mindset, which I think so many people do, then they're really pushing to kind of change things. And so I think it would be a good question and thinking about, what does this current generation think about colorism? How do we address colorism? So I'm going to push that back to say, like, that's a great research question. And I think that that's a great point of advocacy. Create a social action project, work with young folks to say, here's this issue. How would we solve this issue and create that thing? Future Dr. Princess.
First of all, thank you so much for saying that. And I just wanted to thank you for not giving up on your dreams so that we can hear you today and that we can see you today, encouraging us and inspiring us.
Thank you so
And
much, Princess.
yeah, and actually my uncle met you. He's an MBJC actually for Black LGBT.
Oh, wow.
Yeah, actually. So when I saw you, I was really surprised.
Wow. Why is this such a small world? I love
Yeah.
I love NBJC. That's so
Yeah.
great.
So your research highlights the importance of culturally grounded, strengths-based frameworks for Black students. How can educators and community leaders address internalized racism and colorism within the Black community while fostering supportive and affirming learning environments?
It's a good question. That's great. I think one of the things I've found is I think there are a couple things. I think teachers, I've worked with teachers to do so we've seen some psychology studies. I alluded to them a bit with eye tracking. And so what they do is they do when they have eye tracking studies, they notice where they say to teachers, they say, um, something is going to happen in this classroom. Please watch what happens in this classroom. And then they look where children, where teachers' eye gaze goes. And what they find is that teachers, in that situation, when they're told that something might happen in the classroom, teachers are more likely to look at Black children to think about that they may be perpetrators of that thing that's happening in the classroom. And so one of the things we can do is actually, there's power in information. And so we can work with teachers to think about that if they have kind of biases around children, and that their kind of responses to think about when we're looking at for problem behavior, we look to Black children, but when we're looking for solutions and answers, the eye gaze goes to white children. Then why is it that we see that disparities in thinking about tracking and vision, and children also pick up on that? So when we talk about the internalization, again, children will say to me, when the teacher always thinks that I'm doing something wrong, or they only call on me when I'm not paying attention. But like when I have the answers, they don't call on me when I have the answer. They don't seem to notice. And so one of the things they can say is like, what we see is Jason Akanafua talks about a toxic social ecological cycle, and this idea of thinking about that, the cycle of thinking about that when something happens, the teacher reprimands, then they lose trust in the institution. And then when they lose trust, then they might feel less likely to feel like they belong in school. They may see themselves as less smart. We want to disrupt the cycle. And when we disrupt the cycle, we can do things by teachers can say, oh, I am prompted and reminded that it is important for me to look equitably across the classroom and make sure that I am at when children are raising their hand, that I'm not calling on the same people every time. I'm changing who I'm calling on. We teach them how to do things like calls when good things happen. Like so much happens when calls the principal's office, or when there's negative or problem behaviors. We talk about like warm calls. Here's what your child did that was really great. That can build relationships within relationships among teachers, with parents. It can build rapport and relationships among students with teachers, because you're like, oh, yo, did you guys, like, she called my mom to say that I did this really cool thing. Like how amazing that would be. Like, what if your professor like called your parents and was like, yo, like, you are such, like, your student is really great in class and has such great and insightful answers. I don't know if a professor ever did that, I would feel really warm and fuzzy, though that would like violate all types of like things we can't, but it would be really cool to get positive phone calls. And so some of the things that we really think about is, again, we can reduce the problem behavior, or we can promote and boost the things that are going well. And so a lot of the things in psychology we find is when we boost the things that are going well, we actually reduce the things that are problematic. So when we think about attention and eye gaze and support and shape that then shapes how teachers see, and they start to see the brilliance of every student in the classroom. When they see the brilliance of every student in the classroom, the students become more excited to contribute to the classroom. They start seeing themselves as positive learners and part of a community. And those are the things that we see. If you remember the 6 things we talked about in terms of preventing suicide, part of community engagement, feeling like you're part of a community, feeling like you are supported in your everyday life, those things reduce mental health outcomes by also supporting self-esteem. And so they're all kind of intertwined. And so I think that part of what I love about psychology is sometimes it's not that we're creating something new or something that we don't already know. I talk to a lot of people and I say my favorite research is water is wet research that literally something, right, that we already know. We know that water is wet, and yet when you look at the research studies, no one has actually said that thing. And then you research that thing. Like, for example, one of the biggest things that for me is in Black child development research, what I realized is, so what you saw is you saw a parent and a mom and a daughter talking. And then I asked you to kind of like, what's good here, right? I had you look for the goodness. Do you know that before I started publishing, research didn't really observe Black families outside of an intervention? They intervened first. But how can you intervene if you don't know what's happening? This seems like this is if like basic science research, right? If we are going to diagnose a patient, we need to actually learn, right? We learn about the patient before we come in with the intervention. But what we see in psychology research is because of assumptions that they had about things that might not be happening in the home, they were creating an intervention and then they were testing the efficacy of an intervention without getting baseline data. That's not good science, y'all. It's not good science. But then that means the science I create then is a little water is wet. Parents are having conversations with their children about mental health. That seems like that to me is like, I mean, not all families are, but a lot of the families were having these great conversations and they were like, wow, they're having great conversations. And I was like, this research should already have been done before. Before we know that when we're doing any type of diagnosis or before any type of program, we should look at the goodness. We should look at what's going here, the goodness and the badness, like what's going on here, what could be improved. That should be our baseline. That's where we should start without, but because we make assumptions about certain populations of people, then those assumptions then drive our behavior. But we should really be thinking about how do we learn about the families that we want to work with, the children that we want to work with first before we move to intervention. And so a lot of that water is wet research establishes and says, like one of the things I published on is looking at joy. And we find that joy in families actually it was a protected process during COVID-19. But not joy that I didn't create any of the joy. Like we just asked them about, tell me about what it was like for your family. It was really difficult, but also joy. And so we established this idea of joy. Joy is not happiness. Happiness is often tied to external, but joy can be something that's also, an internal fruit. So I think that we are possibly at time, but this has been so fun. I just, again, congratulations to y'all for joining this on
Thank you so much.
your break. It's been so fun.
Thank you so much. If we could go around and give another round of applause to Dr. Mims. Thank you so much for answering all of these questions and for your talk. We all really appreciate it.
Of course. All right.
See you. So everyone, now we're going to go with the interactive part of the session, which is going to be a quiz. I'm going to present my screen so you can see like how it is. Here. I'm going to send both the link and the number so that it's a little bit easier for you to access. And yes, here's. So, it's here. So if you could all start joining. And yes, like Ayan and Tamina said, we're going to be taking a little bit of a break while you guys join. And when everyone joins, we can start the trivia. Okay, so is anyone missing? Can you say on the chat so that we know? If not, I'm going to start the quiz. So we're gonna wait 30 seconds that are left on the break. Okay, so I think we're ready. Sorry that there's a little bit of background noise, but we're going to start and answer the questions to the best of your ability. Am I able to? Yes, you can watch only the presented screen. Try to answer like on your own, on your mind, or if you want to write it down in a notebook, that will also be okay. So you can compare it afterwards. So let's start and have a lot of fun. Good job, guys. Most of you answered it correctly. Okay, we did a little bit. Is anyone else with their screen frozen? Like, did you all see my screen?
I have my screen frozen.
Okay,
I'm able to see the screen. Is anyone else having that issue? If not, you can feel free to like join.
I'm able to see it, but I think if they have somebody pinned, they can't see it because on the very corner she has it as like screen sharing, but she has it as like a second host, so it's not pinned. So you may need a pinner.
Okay. Can you do that? I don't think I have the
Oh
setting.
yeah. Oh my God. I'm sorry. I need to give you a co-host.
No, no worries.
can you all see it now? Yeah. Oh yeah. So let's go to the third question. Sorry. Yay! Okay, next. last question. Yay, guys, we had a great class performance. So if anyone could give a round of applause to everyone, you guys did a great job. I am now going to be sending the second attendance form, and we are going to be doing a Q&A and a homework assignment, something like that, that Amar is going to explain with you guys.
Yeah, well, again, thank you again, Camilla and Ayan today for hosting. You guys did a fantastic job. Everyone, give them a round of applause, as well as our other amazing interns who helped moderate today's chat. Truly, this program would not be as successful as it is without their help, their assistance, and their support. Yeah, we'll give everyone a few seconds to do the second attendance form. Again, this is mandatory. Camilla just sent it out. So please do this as soon as possible because it will close in the next 15 to 20 minutes. Should take a few minutes to complete. And then we also wanted to introduce our homework, our session homework, which is mandatory. It's separate from the attendance. The homework will be sent out on Slack right after the end of today's camp day. We'll send out the homework. The homework will probably take you 20 to 30 minutes, and it is mandatory. So make sure you complete that. You'll have 1 week to complete it, and we'll send it out right after today on Slack. We'll send a few reminders as well, but there's been a lot in the people in the past who forget to do the homework and who attended the camp, and it's really unfortunate because we want to make sure you're able to complete it so you can get a certificate because that is necessary for you to gain the certificate and those shadowing hours. So yeah, you'll have 1 week to complete it. I would say do it as soon as possible. It shouldn't take you long. Yeah, if you have questions when completing the homework, feel free to reach out to any of us on Slack, and we'll be more than happy to help. Yeah, so we'll give everyone like a few minutes to fill out the attendance form. And once you fill out the attendance form, and if you don't have any questions for us, if you don't want to stick around for a Q&A, you can feel free to hop off. Again, thank you for joining. It was great meeting everyone. I am continually impressed by everyone who took time out of their winter camp this winter to join. I encourage everyone to apply to our summer program. Our summer program is this you guys had a 3 day kind of insight into what our summer program would look like. Our summer program is 2 weeks long. So we have 2 weeks full of guest speakers, 6 sessions. We have a research competition, we have a research symposium. It's a really big effort. And those that applied to our winter camp, we would love to see you at our summer program. And we hope you enjoyed. And again, thank you again for taking your time out and joining us this winter. So yeah, we'll go ahead and transition to our Q&A section. So feel free to ask. This Q&A section is pretty much open to anything that we've discussed at our camps, as well as if you wanted to get insight into shadowing, research, tips, opportunities. We're going to have a panel of students and interns that are going to be leading this. So if everyone that's going to be helping co-host just raise their hand so people know who they can ask questions to, we can go ahead and transition to that. So we'll keep an eye out. Feel free to raise your hands and ask questions if you have questions about the case study competition, if you have questions about research, how to get shadowing, how to get clinical experience, anything really. This time, feel free to open and we'll take questions. This section, we can go ahead and stop the recording.